I'll call the October 7th, 2014 Longmont City Council study session to order. Could we please start with a roll call?
Mayor Coombs.
Here.
Council members Bagley.
Here.
Christensen. Here. Finley. Here. Levison.
Here.
Moore.
Here.
Santos. Mayor, you have a quorum.
Thank you. Let's stand for Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Public invited to be heard. The first person on the list is Marilyn Monette. So please come down and state your name and address for the record.
Hi, my name is Marilyn Monette. I live at 2840 Shadow Lake Road in Lafayette. No, I'm not lost. I'm here in front of the City Council today to share with you that I recently joined the Longmont resident curbside composting campaign. And I was part of the Lafayette curbside composting campaign, and I'm proud to say that we were successful we'll be bringing curbside composting to Lafayette in February of 2015. And I wanted to share, I have lived in Boulder County for 20 years. I've worked in Longmont for over 11 years at Amgen in Human Resources, and I'm a certified composting recycle geek. And as a community in the county, we could do better in regards to composting. Composting is the quickest, fastest, most efficient way to reduce methane gases in the environment. And there's no reason why our community shouldn't be doing composting residentially. And so I'm here to ask for your support in working with the resident team in bringing curbside composting to Longmont. Thank you.
Thank you, Marilyn. My wife would love you. Next up is Tom McCoy.
Mayor, Council, Tom McCoy, 27 Cornell Drive, Longmont. And I'm here as a board member of the Longmont Old Firehouse Art Gallery. And you've heard from some of our people before. Our budget does not really rely totally on city support or money, but our growth certainly does. And supporting the arts is a critical issue as far as I'm concerned. I've been on the board for some time, and I think you've heard from some of our people. We are a destination in Longmont. Last year, 6,700 people came through our door to visit our art in our gallery, and 12 unique and memorable expositions that were put on. That was 11% increase from what we had before. We have several really great art programs that help. The Casa Esperanza is one of them. Art Attack, which helps young people really get acquainted with the arts and know what the arts are all about. And we have these programs, and that's where we need your help in the funding to make sure these programs grow, as we certainly do in the city. Check my notes here. I can get my page turned. The total earned income for 2014 was $20,000, and we have a diverse program for many different levels of art and levels of activities. In addition to the income earned this year, we spent $3,000 remodeling the inside to make it more efficient and more attractive to draw people into the gallery. And I think that's kind of a key part to all this. We have a full budget numbers. The total contribution income was $38,670, and our total income for the budget year 2014 is $75,802. So we have a budget, we have the numbers there, and we need your support in a big way. And the second item that I'd like to just bring up, and I heard the lady before me come up, I just left the board of EcoCycle after 8 years service, and we're working and pushing for zero waste, and we hope that we can get the city on board to do some ordinances that will require not only residential but commercial support. Thank you.
Thank you, Tom. All right, is there anybody else who'd like to speak at the council at this time?
Like the outfit? It's that time of year.
Yeah.
Layers. Paul Tiger, 452 Dixon. I'm going to offer you an opportunity to save some money on your budget, and that would be we have art walk blocks the streets, during which time you only have taxable income between 3rd and 4th, or maybe 3rd and 6th. Can't really tell. The rest of the street is empty, and that happens 3 times a year. The merchants in the block that I work in, where I have my business, and to the north of me, where they're completely blocked in. You've seen my email, and I really don't want to beat it to death, although maybe somebody didn't read the email. I offered you that in 2007, the Land Council, along with the former city manager, decided to foot the bill for Art Walk to block the street. My wife and I have been attending Art Walk for many years, almost a decade before the street was blocked, and it's not. I don't know what it's doing. It helps people out there in that 300, 400 block to have a party in the street. And so between 3rd and 9th, not 6th, as it's published on the Art Walk website, the street is empty. I visited one of the dress shops that's just up the street from me. The girls there were in tears. They work on commission. They see this huge crowd of people, but there's barricade after barricade. There's a cop truck parked in the street with lights flashing. It looks like a crime scene. The whole thing is, I'm asking you to save some money and not block the street for Art Walk. Art Walk's still a wonderful event. If we could get Art Walk to cover all of that, again, the parades, the Festival on Main, wonderful for my business, wonderful for the other businesses, but Art Walk is not the same, and I'm asking you to save some money, free up the street, put Art Walk back on the sidewalks. Thank you very much.
Thank you, Paul.
By the way, yeah, let's pass some ordinances that make businesses recycle. I do that naturally. You guys know that. Thanks.
Is there anybody else who'd like to address the council on first call, public invited to be heard? All right, I will close public invited to be heard. So now we've got some proclamations. Scott Dunn, the chairman of the Planning and Zoning Commission, is going to hear that. And also Michael Schernick, Planning and Zoning Commission. So I'll go ahead and read this proclamation. Proclamation designating October 2014 as Community Planning Month in Longmont, Colorado, whereas change is constant and affects all cities, towns, suburbs, and rural areas, and whereas community planning can help manage this change in a way that provides better choices for how people work and live, and whereas community planning provides an opportunity for all residents to be meaningfully involved in making choices that determine the future of their community, and whereas the full benefits of planning require public officials and residents who understand, support, and demand excellence in planning and plan implementation, and whereas the American Planning Association and its Professional Institute, the American Institute of Certified Planners endorses National Community Planning Month as an opportunity to highlight the contributions sound planning and plan implementations make to the quality of our settlements and our environment. Whereas the celebration of National Community Planning Month gives us an opportunity to publicly recognize the participation and dedication of the members of the Planning Commission and other resident planners who have contributed their time and experience to the improvement of Longmont. Now, therefore, I, Dennis L. Coombs, Mayor, by the virtue of the authority vested in me and the City of Council of the City of Longmont, do hereby proclaim October 2014 as Community Planning Month in Longmont. And I invite all citizens in the community to recognize the many valuable contributions made by professional community and regional planners and extend heartfelt thanks for the continued commitment to public service by these professionals in our community. Go ahead and say a few words first.
Yes, thank you, Mr. Mayor. Scott Dunn, the Chairman of the Planning Commission, speaking as Chairman on behalf of the Commission, also on behalf of the staff. Joni from the staff can speak to it more. Some of the events that are going to be planned for this month, which we're delighted with the opportunity with the comp plan update coming up next year. I know it's a hope that some of the events this month is a way to draw some public attention, get people excited about the process, and which to enhance, even a wider public involvement when we do the comp plan update next year. So this is a great way to start that process. Did you have something to say, Joni?
So I was able to get a good portion of our professional certified planning staff to attend this evening. I see at least 5 of them along with our support staff. And what we do couldn't also be done without our great planning commission, so they support us and do a lot of hard work. For a volunteer gig, it really requires a lot of them. So we did put out a challenge to ourselves on staff to come up with some events, and Phil has won the award for doing it the fastest with the mayor's assistance. So the one event that we know for sure is on the books on Thursday, October 23rd. The mayor and Phil will lead a bike ride of the new Longmont Loop that will be on our bike map that's going to come out here in the next 2 weeks. So stay tuned. We're going to have a few other things that we're going to do this month as well to get people involved in planning and talking to us about what we're doing next year.
Great.
Your book is kind of in the way here.
Yeah, sorry. Liability.
So next we have a proclamation designating October 2014 as Pregnancy and Infant Loss Awareness Month in Longmont, Colorado. And Marika Varas, founder and executive director of My Baby Angel Foundation, will accept the proclamation. Yeah, go ahead. Oh, I'll go ahead and read it first and then. A proclamation designating October 2014 as Pregnancy and Infant Loss Awareness Month in Longmont, Colorado. Whereas on October 25, 1988, President Ronald Reagan designated October as Pregnancy and Infant Loss Awareness Month by signing a proclamation 5890, and whereas approximately 1 in every 4 women suffers a miscarriage, stillbirth, or infant loss, and whereas My Baby Angel Foundation and other organizations work diligently to support women and families who have faced this significant loss, and whereas recognizing October as Pregnancy and Infant Loss Awareness Month in our city will provide bereaved mothers, fathers, and family members with the acknowledgement of and compassion for the great tragedy that has impacted their lives, and whereas bringing public awareness to this grief will help those who feel marginalized in their loss to see a compassionate society that can appreciate their suffering and grief. Now, therefore, I, Dennis L. Coombs, Mayor, by the virtue of the authority vested in me and the City Council of the City of Longmont, do hereby proclaim October 2014 as Pregnancy and Infant Loss Awareness Month in Longmont, and I invite all citizens in the community to be aware of My Baby Angel Foundation that is helping transform our society's response to pregnancy and infant loss.
Good evening, Mayor Coombs and City Council members. My name is Marie Cabarrus, and I'm the founder and executive director of My Baby Angel Foundation, 421 21st Avenue Suite 213 here in Longmont. Today marks the 3rd year that we've received a city proclamation recognizing October as Pregnancy and Infant Loss Awareness Month in Longmont. I want to thank you. As was mentioned in the proclamation, we have had a national signed proclamation since 1988, yet this information is rarely known. Even now, with the city proclamation, there will only be a small segment of our city population that will become aware that October is Pregnancy and Infant Loss Awareness Month, unless we tell them. By establishing a city proclamation, we move from fear to love as a community. All of our lives have been touched by loss, some harsher and more devastating than others. I think of the flood last year and all the efforts it has taken to rebuild and reinvest in a new beginning. This work is not over, and it will take a long time, a step-by-step process to get us there. Like the course of the river changing, lives were altered forever. For 1 out of 4 women, miscarriage, stillbirth, or an infant loss shatters their dreams and hopes for a family. It happens every day in our community. How do we show them as a society that we care? We take action, and we open up the taboo conversation of pregnancy and infant loss by listening and sharing. We shatter the silence. We increase our research, and we find new answers in prevention. Thousands of parents every year have no explanation for the death of their babies, yet funding for research is limited. I recently saw an ad in our local paper celebrating October as Breast Cancer Awareness Month. There can be a sense of celebration when we bring pain and suffering into the light and infuse it with hope. Is that what we give 1 out of 4 women when they suffer a pregnancy or infant loss? Last month, I was contacted by a family in our community whose infant daughter, Evelyn Claire, died on August 19th of SIDS, sudden infant death syndrome. Her parents are traveling this week, or they would be here this evening. Evelyn's mother, Erin, has asked for our support in getting the Sudden Unexpected Death Data Enhancement and Awareness Act, S-2746, passed. On September 9th, the U.S. House passed the bill, and now the Help Committee must prioritize the passing of the Senate bill. This legislation will help us with development of protocols and data collection so that we can better understand how to prevent these heartbreaking deaths. In these packets that we have for you, Erin has written you a personal letter, shared a beautiful picture of her daughter Evelyn, and given you information on S-2746 and ways that you can help. We also have a button you can wear through this month to tell others that October is Pregnancy and Infant Loss Awareness Month. And I hope you'll wear that tonight. Evelyn's precious life and the lives of all babies matter. In closing, we send a message by our actions, For those of you in the audience or listening to the recording, tell at least one person that October is Pregnancy and Infant Loss Awareness Month. Contact me and I'll send you a copy of the proclamation that you can share. Tell your story or listen to someone share their story of pregnancy or infant loss. Support S2746 by contacting Senator Udall and Senator Bennett's office. Take compassionate action and help transform society's response to pregnancy and infant loss. Thank you.
Thank you, Marika.
Keep going a little bit. There you go. Yeah. Good. One, two, three. I'll take another one real quick. One, two, three. Thank you.
Do you want to introduce the next item, sir?
Mayor and members of council, Dan Eman, Emergency Manager, is here to provide council an update on the Longmont Community Health Network.
Mayor, members of council, thank you for the opportunity to talk to you tonight about a little update on the Community Health Network. The last that I talked to you, it was to kind of celebrate the good news that we got a $500,000 grant from the Colorado Health Foundation to really pilot the mobile integrated healthcare program. And I'm here to give you a little presentation on what's been done since then and some things we're looking forward to in the future. Oh no. Stand by. Okay. So just to set the stage a little bit, we're still at about 16% of our community without any health insurance, and that is post-Affordable Care Act. You know, pre-Affordable Care Act, we were at about 19%, so we have seen a little bit of an increase, but that's still, you know, in the 15,000 people in our community that have no health insurance. We still, as a country, spend about $8,000 per person on health care, far more than any other country, and by every objective measure, the quality isn't as good as it could be. Care is still fragmented. Our system is not set up to work for those that have complex issues, that have social barriers. Our healthcare system is just not set up to accommodate those people. So that's what our program is really trying to do. As a reminder of what we're really trying to do with this mobile integrated healthcare program, we take referrals from primary care physicians in the hospital for primarily chronic disease management. That's kind of the typical that's never all there is to the story. We provide a series of in-home visits, and I think that's really the core of what makes our program different. We do the work where the patients are. We go to their environment, whether it's a home, whether it's their RV, whether it's a park bench. We go to them and really try to understand what their barriers are. We're really focusing on the uninsured and underinsured. A lot of the times the patients we see do have a payer source, but that's not always the solution. We want to make a meaningful connection between the patient and their primary care physician. You know, there are some times when patients will tell us, yeah, I have a doctor. Have you seen them in years? Probably not. You know, the entire relationship with their primary care provider is a 12-minute primary care visit, and that, in my mind, is not a meaningful relationship. The core of who we are is connecting to things that are already existing in the community. We don't want to reinvent anything. There's a lot of agencies out there that are doing incredible work, and we want to connect to every one of them. We want to prevent unnecessary ER visits, unnecessary admissions, and we really want to prevent cases from becoming what we call the 5%. And we've showed this graphic pretty much every time I've presented, and really the bar on the left, where it says top 5%, that means 5% of the population expend 50% of the overall healthcare costs. That's a staggering number. What we want to try to do is prevent cases from getting there. We want to intervene before their conditions become so chronic and so unmanageable that they're in that 5%. So what have we done? We're at full staff as of August 1st. We've hired 2 paramedics and a coordinator, and they are in the audience today. Feel free to stand up, guys. That's Darren Conradson. He's one of our paramedics. Peggy Martin, another paramedic, and Krista Peacock, who is everything else. They are incredibly experienced paramedics. They're wonderful, caring human beings, and we could not possibly have hired 3 better people for this program. And they will certainly be available for questions, which they're excited about. We've purchased a vehicle. We've equipped it. We've worked through the incredibly complex and mind-numbingly painful health record system process. We have a health record system for us. We're working with the hospital to get access to theirs, which is an incredible coup. Salud, of course, has their own. We're working with them. And CREO is the Colorado Regional Health Information Organization. Healthcare, I think, is almost as bad as the FEMA world on acronyms. So it's a good competition. We've built chronic disease packages. This is something we did in partnership with the advanced illness management team at the hospital. We've established a case review team, which is really a grouping of experts from every agency around us. They've been trained. Motivational interviewing is probably something they use the most. A lot more chronic disease management, some assessment tools, just things that are typically out of what a paramedic does and are more almost in the social worker bucket, but we're really trying to provide them with the tools that they didn't have. And this is probably the biggest thing we've done, is build relationships. This is something we talk about all the time. Knowing who to call, knowing that they'll answer the phone, knowing that they'll show up when we ask, and this has been incredibly critical for us. So we're really, at least my mind works in systems. So what we're trying to do as we look towards sustainability is create systems that can be in place forever. Things that are connecting people that weren't necessarily connected before. And one of the really incredible benefits of pilot money is you get to kind of celebrate things that you never knew would happen. And this connection is one of those. The Hope Light Clinic is a free clinic in our community that was started by a retired primary care doc who, as he explained it, doesn't play golf, doesn't play tennis, but he knows how to care for people. So he's partnered up with the Church of Christ, and Tuesday and Thursday nights from about 3 to 7 or 2 to 6, they're open and anybody can come in. So our center has a program where they invite the St. Benedict's Health and Healing Ministry in. Their nurses come in, and on every Thursday, I believe, they do screenings. So one of the things they were doing is referring patients to Hope Light without knowing that they would ever get there. So we're bridging that gap. Our paramedics work at the Hope Light Clinic every time it's open. They work at the R Center, and they're the bridge. They're the gap, and they provide all of the follow-up care that's necessary. Salud is where we plan to start. That was our goal, is to start with Salud. We take referrals directly from their primary care providers, and they have a existing transitions of care program with the hospital that they use AmeriCorps volunteers for. So we're partnering with them to kind of extend the reach of their program. And then the third system we're putting into place is from the hospital. We're taking direct referrals from admitted patients. So their care coordination staff and our team have developed a screening criteria. We know what we're going to get. We know what's going to happen to them after they get referred to our program. And we're going into the hospital enrolling patients today. In fact, we did one today. One of the things we're doing that's a little different with hospital patients is we're working on this congestive heart failure project. That one of the things that hospitals get penalized for in the Medicare world is repeat admissions if they come back in 30 days with the same issue. And congestive heart failure is one of those that they see a lot of. So what we can do is, in the paramedic scope of practice, is they can deliver certain medications in a patient's home. So for example, if a CHF patient experiences some weight gain, it's probably because they're retaining fluid, which is kind of a bad thing for CHF patients. So what our paramedics can do is, in partnership with the cardiologist, keep that patient in their home, deliver medication, and monitor them there. The other side of that scenario is if we don't do that, it's a 911 call. It's an expensive ambulance ride to an expensive ER and an admission. So if we do that a couple of times, there's a number of different savings, and it's just better for the patient. So I want to kind of explain a little bit of what it's like to experience the entire system here. Just really quickly tell you what it's like to be a patient. So typically, what we see is older adults with multiple chronic conditions, diabetes, congestive heart failure, hypertension, and almost inevitably there's a mental health and substance abuse issue. They're either homeless, have been homeless, living in a vehicle, have an unstable living environment. They're unable to access primary care either because they can't afford the copay, they can't get off work. A lot of system issues, don't necessarily understand how the system works, don't necessarily understand what's available to them. That's kind of our basic patient that we see. So what we do is get a referral. We schedule a paramedic within 48 hours, and then we start our process. We go to their home, we enroll them, we get all the releases signed, we run through kind of a rash of screening tools. What medications are you on? A mental health screening, a substance abuse screening. What does their home environment look like? And we try to talk to them about what are your barriers to care? What's preventing you from getting care? What really are your issues? Then we take that information, we build a care plan. We have a template care plan, we fill it out, we try to come up with what we think are the issues. If this patient is complex enough, we bring it to the case review team, which meets every 2 weeks. And that is attended by everybody that could be doing things for this patient. And one thing we find is there's typically agencies already involved with these patients, but they don't know that each other's involved. So just the fact that we're convening this group and getting together at the same table, it's entirely possible the best thing for this patient is to transition their care to one particular agency, but they don't necessarily know that we're working together. So this has been an extremely effective means for us to really provide effective, defragmented care. And then from there, one of the visits we typically go on with them is a return visit to the primary care physician. We allow them to experience what it's like for them to advocate for their own health care. We talk to their physician. We say, here's the care plan. Do we want to change this? We have the patient there. It's very patient-centered. What are your goals? And we come out of that not only with a better care plan, but we're showing the patient what it's like to experience a meaningful relationship. And then we really go to work. Then the additional visits and the phone calls really are about building self-sufficiency for that patient. Do a lot of time connecting to people. We talk to the Hour Center almost daily. We connect them to Meals on Wheels if they can get there, transportation services, mental health partners, all of our partner agencies we try to connect to and try not to fill a gap that does not need to be filled. We want to have a graduation within about 60 days, and since we really started this in August, we haven't really got to the point where we can talk about a lot of transitions back to primary care, but our goal is to kind of keep the cycle moving so we can continually have patients coming in and out of our program. And one of the really cool things that I get to do sometimes is tell good stories about people. And we have a pretty good story to tell you. But before we get there, we're typically running about 30 patients, a lot of home visits. We've worked through an enormous amount of legal agreements. Like I mentioned, full staff as of August 1st, we had an open house. Thank you to Councilmember Bagley who attended that. Our paramedics work at Hope Light. We partner with St. Benedict's. And like I mentioned before, we're building relationships every day. So I'm going to tell you the story as much as I can without trying to violate patient confidentiality. But patient X is a current patient of ours, has several complex diseases, an unstable housing environment, low income, and he's cared for by his wife who works during the day. So this patient has diabetes, and in the course of a kind of a drop-in, our paramedics went to this patient's living situation and kind of pounded on the door for a while. It took quite a while for this patient to come to the door. Once they got in, they discovered a couple different things, signs that perhaps there was a seizure involved, and this patient had extremely low blood sugar. There wasn't anything really in the house that even if this patient had woken up that they could have raised the blood sugar on their own. So, of course, our paramedics do what paramedics do. Got that patient back to a point where they were normal blood sugar, but the wife wouldn't have been home for 6 or 7 hours. So if our paramedics hadn't have been there that particular time, that particular day, we could be talking about a very different outcome. And that's just one wonderful story that we get to tell in the first 60 days of this program. So what's next? Some things we're looking forward to. Data is a really big deal. We're really trying to connect to sources that are allowing us to build a case. And that weird-looking diagram there is something that the Camden Coalition uses. They call it their patient EKG. And really what it is it measures what utilization that patient had of all systems before intervention. It's 911 calls, it's ER stays, it's admissions, it's all of the things that patient did while their care was unmanaged. Then the middle point is the intervention, and then the blue stuff is utilization post-intervention. To do that, we have to connect to a lot of different data sources, and we're working on those. They're painfully slow. They're all different. It's taking way longer than I thought, but it's something that's going to be really important to us. And the biggest gap in service level that we have is integrating a behavioral health component into early assessments. We don't have a social worker on our team. Our paramedics have sort of become social workers, but I think one thing that would be wonderful for us to have is that professional assessment early on and the ability to do some real service on a day-to-day basis. The grant funding at current spending levels will expire in about July 2016, so we're continually working on how can we sustain this program. And sustainability can look a million different ways. We're trying to investigate every one of those. We would love to be able to increase the service level we provide. There are some programs that include a nurse practitioner and a social worker as part of the team. If we did that, it would allow us to kind of get more into that, treating those 5% cases. Now we don't really have the capacity to do that. We want to get the patients before they get there, but we would love to be able to add service levels to our program. And then the biggest thing is to keep trying to partner. You know, we talked to Front Range Community College this week. We had Representative Singer was in to talk to us this week. We're turning over every rock we can possibly come up with. So I want to thank you for your time tonight. I really enjoy talking about this. I could babble easily all night, but I will spare you of all of that pain. There's a website up. I'm happy to take any questions you may have, and certainly if you want to ask these guys any questions, they'd be happy to answer too.
Councilmember Levison.
Thank you, Mayor Coombs. I also enjoyed you filling me in on some of the things this afternoon in our conversation, Dan. A couple of things. Looking at the legal and permissions and waivers and all that, how are you dealing with HIPAA?
We're doing that in two ways. There's two different ways to go about that. One is to have what's called a business associate agreement with all the entities, and that allows us to essentially share information about that person, but the first key cog in that is a release of information form. And we stole one of those, and essentially what it does is allows us to have all the member agencies have seen it, and it lists out all the agencies so the patient can select which agencies we can share information with. It's been through the mental health and substance abuse issues, which are even more strict than HIPAA. So we've done everything we can think of to protect the patient and certainly ourselves in that regard.
Great. And then one other question. I didn't see anything about dental care. There's more and more evidence in the medical field that good dental health supports good physical and health. And so how are you working through dental health issues? Especially, I know, heart disease is affected by dental health.
Right now, we don't have any specific way to do direct treatment. It's on the list of referrals. Unfortunately, there isn't a lot to refer to, which is the case certainly in things like housing and transportation. It's just one of those big gaps that there aren't a lot of places to go for that. But we don't have any way to directly address that.
Okay, thank you.
Councilmember Christensen. I want to thank you very much for what you're doing. I think this is really valuable because it saves, making these connections has a lot of, I think, cost benefit, but just incredible help for people who, it is a terribly confusing system. And people don't really know, especially people who've been marginalized and are frightened and sick, they don't really understand where to go. So you're the one who connects them, and that's wonderful. And I also wanted to applaud you for home visits, and I know a social worker would be very helpful with this, but because especially as people get older, taking them to the doctor when someone is elderly in the winter through the ice, up the steps. It can be incredibly hazardous for them. And so coming to visit people in their home, in addition to the safety issue, it's also helpful to see what the home environment is, as you saw. Then you realize there are all kinds of problems that need to be addressed. So thank you for what you're doing.
Thank you.
I don't see any other questions, but I would like to basically pile on top of Christensen's remarks that it's a great thing that we're doing, and maybe this will become a model for other cities to follow. So it's always nice to be a city that's trying to lead, and I appreciate all that you do for this city, Dan. Thank you.
Thank you very much for your time.
Okay, Mayor, your first actual study session item will be presented, I believe, by Teresa Malloy, Budget Manager. She'll be going over the final direction on the 2015 budget and public hearing.
Good evening, Mayor and City Council. Teresa Malloy, Budget Manager. And this evening is our final budget presentation for our 2015 budget. We just have a few things to update you on, and then we have advertised for our second public hearing, and then we will need final direction from you this evening so that we can bring back the ordinances that it takes to adopt and make appropriations by fund. And those will come back to you for first reading next week. So the first thing I wanted to talk to you a little bit about is our financial assessment report. So this was sent to you in your packet. Each year, as part of the budget process, staff updates this report. It includes economic data, city financial data, for the most recent completed year, and then 5-year projections, which also include our proposed budget. Normally, we videotape a presentation on that, but we don't have a formal presentation for you this evening on that. I'd be more than happy to videotape a presentation later in the month if council would like. At this point, we're just including it in your packet as information item, as additional information. So during your September 23rd meeting was when we presented our financial policies, and at that point there were 2 financial policies, one that needed some additional clarification, and that was the investment policy, and then a second one that council proposed changes to. So in your council communication, I have provided those 2 policies and clarification on those 2 policies. These 2 policies, as they're stated in the council communication, unless directed otherwise this evening by you all, is what I will incorporate into our final financial policies, which will then come back to you in the form of a resolution on October 28th. So we do have some other updates to provide to you or for you this evening. However, before we get into them, our recommendation to you all would be that you hold your second public hearing, and then we'll go through the rest of the updates, and then it'll be time for you to provide us with final direction.
Okay, I guess, is there anybody from the public that would like to speak on the city's budget? I guess seeing no one, I'll close the public hearing.
Thank you. So Jim is actually going to talk to you about this slide, but while he's making his way down here, what I wanted to point out to you is at your desk this evening, we have provided a snapshot by fund of all of the changes that we have made since the budget was originally presented to you back in August. Each of these changes, there's a footnote at the bottom of the sheet that kind of outlines what these changes are. One of the changes is, and I think Jim will talk a little bit about this as well because it ties into the information that's on this slide. Our fleet manager was able to lock in fuel rates that will extend through 15 at a rate that is lower than what he originally thought he would have to pay in 2015. And so we've got some savings that we have then passed on through the fleet lease rates to the other funds. That amounts to a total of $213,807. And so those are reflected in these changes as well. There's also just a few other changes in terms of probably the more significant one is in the storm drainage fund, that 1.9 million, 2 million of that, essentially 2 million was left over or a budget that was left in accidentally that was in 2014's budget for debris removal from the flood. We didn't get that pulled out before we presented the budget to you, so we are now taking that out. We don't need that $2 million in the storm drainage fund for debris removal. The revenue changes in the GID and the DDA are reflective of those changes that Jim spoke to you about last week. So if you have questions on individual items, I'd be happy to answer them, but we did want to present to you all of the changes that have taken place thus far. So now I'm going to turn it over to Jim.
Coombs, members of the council, I'm Jim Golden. I want to thank Teresa for taking her time so I can get all the way down here. So I have already talked to you last week about the property tax in the general fund and that there was an additional property tax available, ongoing revenues. That number that we gave to you was $211,088. Teresa just explained that we were able to fix our lock in our fleet costs for our fuel costs and fleet for 2015. The impact of the general fund, it's a reduction of expense of $86,383. So that gives us a total ongoing dollars available of $297,000 that you can allocate. So the amount shown below that, the $3,377, is 1.6% of the first number, the property tax number, which was the new or the additional ongoing revenues that were not part of the proposed budget. So that amount of that $211,000 would go towards Human Service Agency funding. So that would leave us the difference of $294,094 of available revenues for you all to direct tonight. Wanted to point out, did discuss last week, and I think since the meeting last week, I did email you additional options about the use of those funds. I'll go over them again. First is to use the dollars to further reset the allocation of the sales and use tax between the general fund and the public improvement fund. Second would be to use the dollars for economic development incentives. Third is to use it to fund some of the requests for council one-time expenses. We could fund some of those on an ongoing basis with these dollars, and then in turn we would be able to use the fund balance that is available for using those on a one-time basis. We could take that fund balance and increase the general fund reserve. And then finally, you could do a combination of any of those three. And so getting back to the Economic Development Center, I want to point out that specifically, as I did last week, I believe that a potential use of that would be, we've discussed previously, it's discussed in public meetings previously, that there would be the opportunity to do a Section 108 loan for the Butterball project for the demolition costs to contribute to that project. And in order to repay that loan, we could designate a portion of this for that purpose. If you don't do that, you would be using the CDBG funds to repay that loan. So with that, I can answer any questions on any of that information.
Councilmember Bailey?
Thank you, Mayor Coombs. Are those our only options? No, what I mean is, can we do whatever we want with that money?
Certainly, the council can decide to use that for any normal general fund type purpose that hasn't been identified to this point.
So I guess, so for example, if we wanted to temporarily halt we've raised fees for parks maintenance. Is it possible to use that? How long would those funds last if we gave everybody a reprieve in the city from the utility fees that we raised?
So are you talking utility fees, or are you talking the park?
So everybody's paying an extra, what, $2?
Right.
$2? So $4. Okay, so we raised it by, oh yeah, that's right. We raised it by 2, and then we raised it by another 2.
And the 2 is for 3 years to help with flood. Additional 2.
Right. So my question is, how long would that $294,000 go for that additional $2 that we put on at the end unexpectedly?
$2. So that
more or less.
$2 is. I had it when you had $4, and then you threw me there.
That's
so
right.
I think it's about 4 months.
4 months. I mean, it might be insignificant, but I wouldn't mind seeing something like that. I mean, we're gonna. I mean, I know that we can get the money for the Butterball stuff elsewhere. I'm just saying that if we find money in a shoebox, and we've taken money out of the coffers or out of the pockets of the citizens under one guise, if we find money, let's give it back. I mean, I know it's only $2, but that's what I say we do. Or at least it's an option that we should consider.
Councilmember Levinson.
Well, I emailed you back last week after our discussion and thought, since we have we really don't have as much in the reserve funds, and there are 2 reserve funds in particular we haven't found any way to put money into. I think we need to use a portion of this for beefing up our reserves. And I know Harold wants to jump in, but I would like to do, we're looking at $294,000. You'll talk about some options with the economic development incentive for the Butterball project. However, I would like to see at least $50,000 go towards reserves, maybe even more than that. While it's a wonderful gesture to be able to give $2 back for 6 months, it might be a logistical nightmare. I know you have to program the computers and get everything going on that, and seeing your bill fluctuate, where it was $2 one month, and then for several months it was $2, and then it's back up to $4. We might spend a chunk of staff time answering all the phone calls. If we do it at the end, yeah. Well, I just think that Jim's for years been harping on reserves. I'd also like to try to rebalance the 85-15 perfect mix toward get more towards the perfect split of the 85-15 as we had previously. So I'd like to use maybe a 3-part, some for the economic development incentive, and some for reserves, and some towards the 85-15, getting towards the 85-15 split.
Councilmember Fallon.
Thank you, Mayor Coombs. I would like to see us, we have total available revenues, and you said one of our options was to use that for continual funding of our one-time funding items?
So one of the options would be to direct those dollars to do ongoing funding of some of those.
So that we could do that year after year rather than having to say one-time funding that's not really one-time funding for
correct.
everything?
Those requests wouldn't come back to you for council one-time consideration. They'd be in our ongoing budget. And by doing that frees up fund balance that could also be then directed
to all those
towards
other
increase
things.
in the reserves.
Exactly.
No, it would be pushed back to the reserves because that would be one-time dollars that's being freed up.
Okay. So I would like to see us use that money for the Longmont community restorative justice money, and I'd like to see that used for sister cities. Those are things that I think we need to put in our budget. And if we don't do it this way, then we need to do it out of some other permanent funding source. And this works for me. I think this would be a great way to fund that, and then use the rest of it to do some of this other stuff. That would be my recommendation. And I'll listen to everyone else, and then I'll make a motion if you'd like.
So,
thank you, Mayor Combs. I guess what I'd ask is if you do make a motion, I'd like to talk about sister cities, but I'd be for I could get behind your motion for the Longmont Community Justice Partnership. My question is just to just regurgitate and reiterate what you're saying is these would still be one-time dollars. We have $294,000 every year.
If you go back to the previous slide,
ongoing dollars.
Those are ongoing dollars. So
Can you go back to the previous slide?
The 294 is ongoing.
It's ongoing every year?
Correct. And so that anything used from that, putting in this, would essentially put it as part of the ongoing budget instead of one-time funds.
And that's because we anticipate every year fleet rates?
No, so there's a revenue that's already been designated towards that fleet expense. So the source of the revenue could be any sales tax, property tax. The point is we have ongoing revenues of $86,000 already that has not have an expense attached to it right now.
Gotcha.
And now we have an additional $211 of ongoing revenue. So this is ongoing dollars.
I think that in my mind of that list, I look at the restorative justice program just like I do the district, county, and municipal courts. And I think it's something that we are the people that benefit from. So I would encourage you to make your motion. I'm not going to step on your toes, but I'd actually want to just get that out of the way and then talk about the others.
So if I can jump in too, because I think there's another, there's multiple pieces here. So if you look at the 294, and you talk about what Jim discussed in terms of potential use on the economic development front, and I think when Kathy talked about the potential need on the Butterball project, that was around $130,000. So if you allocate more than that, and all of this is contingent upon council approving a development agreement. All this is placeholding dollars in case it's needed for that. If there's not enough dollars for that process, that needs ongoing dollars. So there's some math that has to occur where it has to be split up. If that's council's intention to move that. If it's not, then it does push us a little bit more to looking at the 108 loan. And again, these are just placeholders now at this point.
Okay. Councilmember Moore. Thank you, Mayor Coombs. My preference would be to utilize that found money, for lack of a better term, as used for the Butterball demolition, and make sure that doesn't impact our CDBG funding long term. I'd rather see that as a permanent solution to avoiding the use of that CDBG money, and that's the direction I would support. I guess I'm going to weigh in. Kind of leaning with what Jeff is saying. I think it's important to make sure we have enough money to support our obligation to the demolition costs. At least have that placeholder in there so that we're sure that this project is a viable project. Because I think the Butterball project is a real important part of our city's future. Councilmember Finley?
So would we need that economic development money for the next 10 years?
On an ongoing basis, we would estimate that the need for that would be about $130,000 of that per year for 10 years.
And again, it's just, at this point, it's following up on the conversation that Kathy had. It related to the reserve that was put into place in the CDBG funds. It's essentially a potential placeholder. Obviously, nothing is in stone until council would pass a development agreement. This is just merely a placeholder in case those funds are needed. And then if they're not needed, if council chooses not to do something or they're not needed, then that conversation can occur at that point too.
Okay.
Could we make a motion? I'm just to use the 130 for that, and then the rest for restorative justice?
Absolutely.
That's what I would move.
Okay. Councilmember Thomason.
Thank you. So I'm just getting maybe a little bit confused. What other options besides the HUD 108 loan if for some reason we can't get the 108 loan? What are other options?
Mayor Coombs, members of council, we can look to an internal loan from the city's fleet fund. It doesn't change anything of what we're considering tonight because it still would need to be repaid. So that would still need to have some dollars set aside towards that repayment.
So that would be the original amount that we saw set aside in the CDBG budget. They should have gotten a better acronym from the beginning on that program. Was 180.
So,
wasn't it?
I think that was the early estimate. I think if you look at the advantages of doing an internal loan, you obviously don't have the cost, what I would say, and it's not
like the underwriting
cost. There's
and
cost associated with it. There's interest associated with it. Typically in the internal loans we do, the interest rate is lower than if we were to go out on the market. And so when you compare an internal loan versus an external loan, that number could be savings in the neighborhood of $300,000 of doing it internal versus an external.
And it's similar to what we did with the early stages of the Village at the Peaks financials when we had some fleet fund money before we had TIF revenue that we could, or not TIF revenue, we don't have any TIF revenue yet, but before we could get things going that we've already paid back. It would be the same idea of paying back the fleet fund when we had borrowed it from other projects. It's a pretty common practice we've used, isn't it?
Mayor Coombs, members of council, yes, we've used it for a number of different purposes and continue to do that.
So we're looking at the true numbers, 130. So if we subtract, I'm just trying to make sure we're doing the math right. So if we,
it's 164.
Yep, that's what I was going to say, 94. I will second Councilmember Finley's motion to direct $130,000 of this money towards an economic development incentive, possibly for the Butterball as a placeholder.
Well, I don't think she's officially made the motion yet. Oh, yeah, okay. Okay. Councilmember Christensen.
Okay. All right, I support that. I do think if there's money left over, though, we should direct it toward the reserve because that will. Is there any money? Would there be any money left over this way?
Mayor Coombs, and I heard the motion to be that the balance of it, the 164, would be to offset the Longmont Community Justice Partnership. Now that would free up 164,094 of one-time money that could go towards the reserve, and I think that probably would though.
The motion was just for the Butterball. That's what I thought the first.
It was also for the other parts.
Yeah.
Okay. Councilmember Riley.
Thank you, Americans. But my understanding was, I don't remember when it was, but my understanding was that maybe it was an option, that it would be a good idea and direction, so to speak, towards staff to just follow and pursue the internal loan. I thought, I don't remember when, but I thought that was a discussion we had recently. You don't need to remind me when, but didn't we just have this conversation?
Yeah, that's what we're doing.
And this $130,000 then would be to repay that loan. There needs to be a source of repayment.
Right. So what I'm saying is there needs to be a source of repayment, but my understanding was that the source of repayment could come from internal mechanisms, or is this necessary to do that?
This is necessary. If we were to look at that as an option, this would be necessary.
Or else it could be the CDBG funds that were originally.
Okay, so in other words, this is the option, this is the tool necessary in order to avoid dipping in to the community development block grant.
That's correct. Right.
Okay, I understand. So that would be $130,000, which would leave 164. Thank you, Mayor. You engineers, it's nice having you around. 164,000 in ongoing revenues. Which, how much do we have available in one-time dollars this year?
300 and no.
Those are just the requests. So there's no extra money. That's just the money we have to come up with if we fund everything that everybody's asking for.
And we do have available one-time monies of $392,520. Yeah.
Gotcha. Understood. And so anything we don't fund off that list, we can do whatever we want, including putting it into reserves. So again, $392,520 in one time and $164,000 recurring is what we're playing with tonight.
That's correct.
I used to play very
plus
loosely.
130 if you choose not to earmark it, right?
Right. But if the motion passes,
if that motion passes, that peels that 130 off. Then you have 164.
If that motion passes, there's no more ongoing because it's all of it's committed.
Yeah.
And the motion now was 130 and then the 164 towards community justice partnership.
Right.
Okay. All right.
Councilmember Robinson.
Okay, before we vote on the motion, I just want to make sure I'm understanding the loop here. So if we dedicate this money this way, then Longmont Community Justice Partnership is going to be part of the ongoing funding at $164,000, and then that frees up that amount of money in one time that then we can direct you to do something else with this year.
That's correct.
Like reserves. It's just basically the shell game. We're just moving
Never
things
gonna hear me
around,
say
right?
that.
Okay. Well, I just want to make sure that because I'd like to follow up with an additional motion. The other concern I have, however, is if we have to apply our priority-based budgeting tool, is there less strength in having the LCJP in the regular budget as opposed to being one time? Like if we draw a line and say we don't have money to do anything but levels 1 and 2, then we can't maybe take a selective. This allows us a selective one-time money, a selective chopping block or not chopping block, in my opinion. If we do say something like we're forced in future years to use the only 1 or 2 level funding and then consider looking at parts of 3, then does that program suffer worse under being in the regular budget, or does it suffer worse being considered one-time category?
Mayor Coombs, members of council, I don't know if you could even
I'm just thinking of a strategy to keep
suffering
supporting
worse,
the program.
But I think there's millions of dollars in quartile 3 and 4.
Okay.
So it wouldn't necessarily mean that it wouldn't get funded. You'd have to make decisions.
Okay. All right. I just wanted to make sure I understood that.
Okay, let's go ahead, Sarah. Or Sandy.
Thank you. Mayor Coombs, would it be possible for me to share an email that Gabe sent me also around what he was thinking
Sure.
as far as some of these funding
Okay.
pieces? So he sent this obviously not having the benefit of this conversation, but in essence, he just wanted to make sure that you all know that his position on it was that the firehouse, the recommendation from him was no more than $8,000 based on the budget information that they sent out afterwards. And the Tinker Mill, he felt that the $60,000 in one time seemed to be appropriate, no free broadband, and can assist with the digital divide program if they chose to. So I just want to make sure that you knew that. Obviously, he could not be here tonight, but I told him that I would pass that on to you all for the conversation.
Thank you. All right, let's vote. Okay, that passes 6-0 with Councilmember Santos absent. So I guess we would also then need you, Councilmember Robinson? Oh, okay. Okay. Mayor Coombs, members of council, then we would also need you to direct us regarding the rest of the request for council one time. So including the difference in the amount of dollars that LCGP had requested at $180,000. So now that becomes 16,000 is with the updated list for jobs.
And I would also remind council that their request was for a full 200,000.
Okay.
We would also need you to direct us to add that 20,000 to the public safety fund.
From the public safety.
Public safety fund.
I know that. It's coming from the public safety.
On the public
From the
safety.
public safety fund.
Okay. Councilmember Robinson?
Yes, Mayor. I'm ready to make the motion that we fund the request for council one time, and note that the Community Justice Partnership would be funded at, did anybody? $24,000. And also note that 20,000 additional will be coming from the public safety fund. Is that the correct? No.
No, that's not the correct. So
So it's 180 minus 164.
15,906 is what the LCJP would be.
Okay. Okay, so that,
Yeah.
okay. Let me restate the motion, please. I would move that the council one-time request shall be funded as presented with one exception. The Longmont Community Justice Partnership shall be funded at $15,906 from one time, with $20,000 funded from the Public Safety Fund.
Councilmember Bradley.
Thank you, Mayor Coombs. I guess my concern is that anyone can show up to this podium and ask for money. And it's really easy for us to say, yes, I'm going to show up next year and I'm going to ask for $100,000 or $60,000 or $10,000 and say that I'm going to dedicate it to, helping, pay me $100,000 salary, and I'm going to use my time doing pro bono divorce work and criminal work for young single mothers. And does that sound good? And I'll create a 501c3 and we're off to the races. I don't think it's good government to just give people money like this. I think that I personally think that some of these, because, kind of like when you give groups, or kind of like when you give puppy food, they'll keep coming back, or you feed the wild animals, they keep coming back. So they've become dependent on us, so I don't think we should necessarily stop, but I think that what we gave them last year would suffice. I remember the first year I was on council, Firehouse got 5, then it got 8, now it's asking for 12. I also think the Tinker Mill, I think it's a great project. However, I also think that, we shouldn't give them $60,000 just because they asked for it. I think it's a worthy project, but the question is, should we as a government municipality be funding it? What about saying, look, we'll match $1 for $1. Your 400 members come up with the funds, we'll match it. We'll be your partner with it. I understand how it benefits the city, but just giving $60,000 to create a cool workbench or workspace, I understand why it's important. I'm going to go out and take a tour of it. I get it. But I just don't think it's a good idea. So I think, anything over last year we should say no to. And I think that we should, Tinkermill, we should limit it to dollar for dollar match and make their members who will be using the space fundraise, donate, etc. It's just really easy to give people money when it's not your money.
One thing that they are already contributing is people are working there for free. So that's a big contribution. I mean, we've got people donating their time and their expertise. So it's not like they don't have any skin in the game. We also developed, a new process last year for vetting a lot of this stuff, and we followed that process. So that's how these people, got to this level, is by following that process. Didn't we go through each one of these things and have, can you educate me on how did each one of these people get their names on the list?
Mayor Coombs and members of council, Sandy Cedar, Assistant City Manager. This process does not have a vetting process to it necessarily. Okay. There are a couple things that we pay attention to. One, if they're eligible for Health and Human Service funding, then they're not eligible for council funding. But other than that, really, they submit a letter of request to the city council, and that's forwarded to you because, as transparent as possible, anybody that requests something of the city council comes directly to you. You could certainly implement some sort of a vetting process for next year if that's something that you would choose to do and help give some guidelines around that. We could develop something like that for next year if you chose. But currently, they need to submit a letter by the time the budget is submitted to the city manager.
Okay. Councilmember Finley.
Thank you, Mayor Coombs. Here's what I would really like to see, and maybe we need some more information on other communities that do this. I'm kind of with Councilmember Bagley in that people who continually come to us year after year for one-time money, that's not one-time money. And those things, if they are indeed a benefit to the community, either need to, A, be put into the regular budget after a year or two, or they need to go away or, find other funding. One of those things that I was thinking about doing with things like Council for the Arts and the holiday lights or the fireworks, I would like to see us, or find out how this works in other cities, in our utility bill, have a checkoff list, and people who want to donate to those things can, in their utility bill, have a checkoff list and say, I'd like to donate, $5 to the fireworks, or I'd like to donate $1 to Sister Cities, or I'd like to donate $10 to the Longmont Council for the Arts. And then at the end of the year, whatever those folks get, that's what they get. That's the community sees value in that, and they're willing to pay for it. I'm all for willing to be that conduit for them to do that, but I am not willing to continue to fund something that doesn't have a place in our budget. That's kind of how I feel about it. Can you guys give us more information on doing that?
Mayor Coombs, Councilmember Finley, if you don't mind. We'd be happy to take a look at that for the utility bill. Right now, the utility bill checkoff is if you'd like to give money to our COPE fund, which essentially helps people who can't pay their utility bills. And so that's currently the only checkoff that's on the utility bill. The other piece of it that I just want to mention is that the Sister Cities budget used to be in the ongoing council budget and was moved to one time. I don't know that anybody else was. Were many of them? Okay.
Many of these were, like the symphony, were the DDA requests, not for ventures, but for the holiday lights. A lot of these were in the city's ongoing budget. We hit tough times. We couldn't fund them with ongoing monies. We continued to fund them in the city budget with one-time monies.
Councilmember Christensen.
I share Councilwoman Finley's discomfort with having things that we fund every year in the council one time. I understand why we did that. I'm wondering, I would like to see a way that we could transfer these back into where they were before so that we could, because we do fund them every year, we should be funding them in the every year budget. I myself, and I do think that Councilwoman Finley had a very good idea in that ask for donations for some of these, because I'm sure that people would love to donate, for instance, to the 4th of July fireworks show and the holiday lights and some of these other things. But I don't think that we should expect that that's the only funding they get. I think the city, these do benefit the city, all of them, I think. And I've looked through all their budgets, I think we all have, and I've tried to see where they have waste. The Longmont Symphony gives us 8 concerts a year, plus the 4th of July thing that's a pretty modest salary, a pretty modest amount of money they're asking for. I think that we should fund them all. If people have problems with specific line items, they can go back and look at the financial information each one of these submitted to us and say, well, I think that's too much, and I think this is too much for this. But I've looked at them, and I don't see how anything looks like there's a lot of waste. You know, it seems like the Longmont Sister Cities Association, $32,000, but when you look at what they're actually providing, I don't see where they could cut anything myself. I would vote for funding this as it is, because we do have the money this year and because these are all very worthwhile projects. Thank you.
Councilman Ward? I'll second the motion. Okay. Councilman Wilson?
Yes, I'll just suggest something that, it's a widely used source, but there's a nonprofit in New York that just deals with educating people about the nonprofit industry. I think it's called the Nonprofit Foundation. I took a training course from them many years ago, but one of the things that's very common practice in the grantee world is that a lot of the major foundations will only give you money for 3 years running, and then they ask you to take a year off completely. Don't ask us for money. Ford Foundation, MacArthur Foundation, all of them, they don't continually, because they don't want to create an entitlement, if you will, for organizations. However, you have to ask yourself a number of questions. Are there other sources for these requests in the community, really and truly? Now, if people don't want to pay, the city doesn't want to pay for the fireworks show, then we'll have 5 minutes of fireworks. And that might just be what will incent people, if we don't pay for fireworks, to get. And similar things. I mean, everyone enjoys the holiday lights. A lot of these categories are, in my opinion, kind of the soft edge of the city of Longmont. Any city of any size, you have a symphony orchestra, community orchestra. In Denver, they're struggling with the symphony in Denver having a home, a very expensive home in a concert hall. We're not funding an entire concert hall. We're just helping pay the rent. And we're maybe not a large source of funding, but we might be that lifeline source of funding that people can count on in their budget to leverage their fundraising off of as well. But if people want to look at policies around, you can apply this many years, but then the next year you have to only apply, you can apply for maybe maximum 50% in your 4th year, then, certainly we can figure out a way to cut this budget. But, we have other organizations through the Housing and Human Service budget that we fund also. But we have that set aside of the 1.6. The other thing we could do is, if we have community groups like this and we want to put it as part of the budget, we could next year, I'm not going to give Jim a heart attack, decide to set aside, 0.1% of our budget for these kind of, I'm not going to suggest it for this year, but like we have 1.6 for Housing and Human Services, we could decide to establish something that gives us 0.1. And then that's our strict amount of money we can work with, and not kind of a floating fund every year.
Councilmember Bagley.
Thank you, Mayor Coombs. I think I'm going to be in the minority on this one, but I just want to point out that just going through this list, Longmont Council for the Arts, my question is, honestly, do we each understand what that is, other than the fact it has the word Longmont, Council, and Arts in it? Regional Air Quality Control, okay? Ooh, it has Regional Air Quality and Council in it. Ooh, that's awesome, too. You know, I mean, how's that money being spent? I mean, I know they showed up and they asked, you guys can all say what you think it's spent for, but there is absolutely no accountability whatsoever from anybody on this list. The only criteria to get the money is to show up and give a letter prior to the budget meeting. So I'm just saying, is that not true? All right, go ahead. Help me out here, Sandy Cedar.
Mayor Coombs, Councilmember, Mayor Pro Tem Bagley, once you approve funds for them, right? So there's no vetting process ahead of that. If they ask for funds, then I give exactly whatever they ask for to ask of the council to you directly. But after that time, then we enter a contract with them, and we enter a contract for the services that they told you they were going to provide in the letter. So once they do that, then I'm the one that monitors that contract, and at the end of every year, they have to report metrics and what they've done with the money that you granted them. So before you grant them money, there's very little process. After you grant them money, we enter contracts and intergovernmental agreements with them to ensure that the money that you're giving them is used.
I understand that. My question is, so there's a contract, and they provide another letter. Is there an audit? Is there verification?
Mayor Coombs, Mayor Pro Tem Bagley, verification, as I certainly go and look and make sure the programs that they said they were going to offer are being offered. Other than that, we don't have a formal audit of those numbers.
So my point is, again, so we don't know exactly if it's working, if it's effective. I would trust anybody on this front row to spend our money because I know you're accountable to him and you're accountable to us. I'm just saying that I just don't know how this money's spent, and I feel uncomfortable voting for it. There are things on here that I can see, like the 4th of July fireworks show. I think as a community we all benefit from, and we enjoy that. I think that the symphony at the park, it's a community activity. We all benefit from it. But I know for a fact that sister cities, they've had some problems with Ciudad Guzman this year. I know that, problems that are big enough that have made me go, God, when that comes up again, should we maybe talk about what we're doing down there? I know that I learned recently that the LDDA, they need to be supported. I agree with that. However, we just voted, they've got 19 years left on their TIF that we're foregoing funds for. And so they could use those funds for that. The Firehouse Arts Center, I'd say competes, but they'd say it's a synergy. But you've got, art in public places, Longmont Council for the Arts, the downtown galleries, as well as the Firehouse Arts Center. I'm just really hesitant to just continue giving money that I think is really just a gimme. It's $400,000 that I'm not going to vote for it. I think there's a lot of things on here that we should fund, but just a general motion I'm not going to vote for because I think we need to be more careful with our money.
Well, clarify, it's not it's the $392.50 because now the second line item has been changed to $15,906 instead of $180. So it's small potatoes, but
yeah, but still,
yeah, it's a lot of money.
Still $300,000.
Councilmember Quigley.
Thank you, Mayor Coombs. Do we have to vote on this tonight? I would really feel more comfortable if Council Member Santos were here.
So one of the things that council can do, Jim and we were just talking about this, is we have to bring a budget ordinance to you. Council could, very similar to the motion about directing the funds into an economic development account in the event that we need them, you could direct us to put those into essentially another council one-time account. We put that in the ordinance, and then we could bring that back to council at a later date. And then you all then council can make the decision in terms of how to fund those. That would be one option that we could proceed with. That lets us put the information in the budget we need to proceed with adopting it, so it doesn't slow it down. Still allows you to fund those. It also, as part of that option, would allow council to consider a process that we go through in evaluating those requests. So there's some other options available. Jim?
No, that would be fine. We would appropriate the dollars, and you could direct us next week or whenever on where they should go. And if for some reason you decide not to fund them, then we would not spend that. If you wanted to go towards the reserve, it would just, not an expense, we would just transfer it there.
So essentially, we put a placeholder
On that money?
for that, and then decide at a later meeting if we wanted to, say change Firehouse Art from 12 to 10, or shuffle the money around in a different way, or
I would
whatever.
feel more comfortable if we had, like I said, Councilman Santos here to have that discussion. And I think when we do it, we should look at each one separately, not just a blanket okay with everything. Even though I'm personally pretty much okay with everything, I think we should have that discussion.
But we do have a motion that's already been seconded. Councilmember Christensen.
Yes, well, as I say, I would be for this because I've looked at everything. I don't see where people could cut their money. But if we do have this discussion, then we need to go through each one of these line by line, each one of these budgets, and find out where people have problems with this and what their suggestions are for cutting money and things like this. This will be very time consuming, but if that's what some people want to do, I don't know. I think we should pass it. That's my opinion, but thank you.
Councilmember Wilson.
Mayor, did you have a comment?
No, go ahead.
Thank you, Mayor. We could spend another 4 hours if we put that money aside. And each of these art organizations, many people who are probably watching from the audience or watching from home, will be coming again. We will spend another 3 hours adjusting, and staff time adjusting things that might affect one way or another 1%. And we've spent far less time discussing very much larger projects. And, it's pretty much in the noise at this point that, are we going to spend a lot of time and bring, 5 board members down from each organization who will want to talk about justifying every last dime, and then we're going to beat up on people, and we're going to say, well, now we don't trust you, or we don't have a favorable opinion of you, so we're going to cut you by $3,000. Then we're going to have to reallocate that $3,000 to something else in the budget. I just think that, if we want to do it more intensively next year, fine. We could spend, again, 4 or 5 hours allocating $300,000 and, barely spend 5 minutes hacking through line items, each line item of the capital improvement program, which is many more millions of dollars. So I just say we do it, but maybe we look at a process and see whether or not there's additional information that we want to have submitted, that we want to in our packets, as opposed to just a simple letter.
Councilmember Bowley.
To put it in terms that we often see city staff present to us, this isn't a matter of $392,000. Over 20 years, this debate will result in savings or expenditures of $7.85 million. So I think that just saying, 4 hours, what the heck, $392,000, let's pull the trigger. Yeah, it's 1% of our budget, but that's a lot of money. And considering that we're here anyway, we spend weeks on issues that are politically charged. Nobody ever shows up for the budget. We got to start somewhere. And I think that going through each of these is, it might be little, and you might think it's a waste of time, but I think that a lot of these things, if we cut them now, we won't have to deal with them in the future. And if we shove them into the permanent budget process, we don't have to deal with them in the future. So we can save some time for our future councils. And they will look back and never know the sacrifice we made on a Tuesday night to debate this thoroughly and get this off their plate forever. What were you going to say, Mr. Gold? I'm not saying we cut. I'm not saying we cut Symphony. You guys are making some assumptions. I'm just saying that we need to make sure before we approve $392,000 that we know what these folks are going to do with the money, that we have a process in place for making sure that the expenditures are verified, that we make sure that your idea is wonderful, that it's not truly every single year, whether it's every 2 or every 3 or whatever, they can't come back. And and in the process, we use this discussion to vet out some of those solutions. I think that's what our job is. The single biggest responsibility we have is to determine where we spend our funding and how we tax our people. And this money comes from somewhere.
Did you want to?
Yes, Mayor, I do want to. So, I think we're looking at $228,000 since you already directed us on part of the LCJP money.
That money will go somewhere.
And we're looking at $228,000, which is about 1/3% of the general fund budget, not the city budget. And I guess, but I do think it's important that we get some direction at some point, whether this should be in the city's budget, whether these should be in the city's budget or not. It would save us with future budgets as well. If you want this in an ongoing budget and direct us so, we would deal with it the way we dealt with the ongoing expenses with one-time commitment. We would find a way to get them in. If it was a higher priority than the sales tax rebalancing, we would put that in. But we need some direction on whether these should be in here year after year, or future councils will sit here and do this annually year after year, because we'll always get these requests. Even if you say no to them tonight, we'll probably still get them in the future. And unless you tell us whether this is ongoing, intended to be ongoing in future budgets at least, we don't know whether to put it in or not, even if we do have the money.
Right. Well, we know some of these things are ongoing, like the LCJP. I mean, that's
what I mean by ongoing is whether you would like to see them in future budgets or not.
Okay. Councilmember Moore.
I'd like to call the question.
I mean, what's the motion on the?
To basically accept the budget as is with the change to the LCJP.
So Councilmember Levison moved to fund the council one-time requests as presented, with the exception that the Longmont Community Justice Partnership's one-time request will be funded at $15,906, with an additional $20,000 coming from the Public Safety Fund.
We need 4 votes. We're voting on calling the question. We need 4 votes.
Yep. Okay, I guess we've got to vote on that first since.
We got to vote on calling the question.
Yes. So let's vote.
Voting on the question?
Yeah, calling a question. Yeah. Okay, that passes.
So, Mayor, I believe you still need to give us direction on the $164,094 that is now available of one-time funds because of the funding of LCJP with ongoing funds. If you want to direct us to put that in the reserve, we'd like to know that.
We got to vote, though.
Yeah.
Sorry.
Okay, so now we got to vote. We've called the question, so we're going to vote on the motion. Let's vote. Okay, it passes 4-2 with Councilmember Bagley and Councilmember Finley dissenting and Councilmember Santos absent. Councilmember Christensen.
Oh. Okay. So now we're discussing what to do with that 164,000, right? I would move that we put it in the reserve.
Second.
Okay.
Actually,
Councilmember Levison.
Thank you, Mayor. Which reserves? We have 4 different reserve funds. And so I support that move. However, I'm trying to look at Which week was it that you told us where the chart with the budget reserves? I have here the operating reserves. That's for the health benefits. Yes, I think it was page S33. Is that the correct page, Jim?
Don't know, but whatever, we would just add it to the reserve for the emergency reserve, which we've been trying to build upon.
Okay.
According to the policy, that is the next target.
Okay, so I'm referring to, just for everyone to know where I am, it was page S33 of the supplemental budget, which was the, which date was it? It was the council communication of September 16th, 2014. You said that in this there's 4 components of the reserve policy. So one, the Tabor component is fully funded. The second one is the emergency reserve fund, which currently is funded at 5.1%. And then there are 2 unfunded reserves, a stabilization reserve at 3%, which is our goal, and a stabilization reserve at 8%. So the comment that you just made indicates that we shouldn't start anything in the reserve stabilization.
The policy actually says the target is to first fund the emergency reserve.
Okay. And so if we do that, where will that number end up being when we recalculate it? Because we'll have to change that part of the committed.
We will add $500,000 that we already identified plus $164,094 to that reserve.
Okay. Alrighty. So that's your motion, is to put it into the specifically emergency reserve fund.
Okay, let's vote. Okay, that passes 6-0 with Councilmember Santos absent. Go ahead, Sandy.
Here comes members of council. The other thing that we need to clarify is the request from the Tinker Mill for the broadband service, because they withdrew their request for the computers and offered to be able to partner with them into the future. And so we're going to have that conversation. But the outstanding request then is the Tinker Mill's broadband request for your consideration.
Councilmember Bagley.
I don't think a motion was made to vote on it. Technically, if we don't make a motion, nothing happens. It just dies, kind of like, appellate court rulings. But I guess, okay, so now that we've done that, we've guaranteed that no one's going to show up and argue from the podium and justify their expenditures. We still have a problem, as was so finely pointed out so eloquently by our budget director. I think that we should direct staff that they should set aside an hour or two where we go through that list and we debate the following. Number one, which of these should be one time into the future and which of these should be ongoing regularly in our budget. Okay, and we can do that now that we voted, and there's no pressure. And then the other thing we need to discuss is what will be the process next year and into the future to ascertain whether or not they're actually doing what they say they're doing. So that is what I move, that we direct staff, that we actually spend 1 or 2 hours or whatever time is appropriate to address those 2 issues.
Councilmember Robinson.
Thank you. So, but Jim, if we incorporate all these things in the budget, we still will have one-time money that somebody will come and ask for next year. Every year there's one-time money.
I'll bet on that too.
Okay. Okay. Well, and I think we should have a process, but the more things, well, I think we're going to end up with the budget even being bigger, which I guess we can always decide to cut the budget, but I think it's more difficult when you just have it all in there in the works and you're not examining things. So I think we could establish a process just like the human service process where, we changed everything up altogether. But I don't know what section I guess this would fall into community services again, or the LDDA part would have to fall in the LDDA budget, or I'm just confused, like where all these odds and ends would end up. So, and then we could still have the same groups coming and asking for one-time money, even though they're already in the budget. They can ask for more.
This is an important discussion.
Well, the same groups will keep asking for more and more one-time money.
So we've got a motion. It's been second. Let's go ahead and vote on that motion. Okay, that passes 5-1 with Councilmember Levison dissenting and Councilmember Santos absent.
So we have a couple of more items up here that we do need council direction on, including the golf fees and then the overall budget.
No, can we take like a 5-minute break?
No.
Yeah.
The vegan diet is like making you all weak.
Well, we've been sitting for like 5:30. take our seats and finish the meeting up?
Okay, this is the last thing, right? Is this it? Jim, is this the last thing?
Yeah.
Good, I don't know. Whatever.
This could be quick. So, Mayor Kuma's members of council, all we need is you to let us know whether you're good with these items here as proposed, and if not, let us know otherwise.
I'm good with those.
I second it.
I would move that.
I second that, yeah. Let's vote.
Any other comments?
We're actually going to vote on it. Let's vote. I think it's pretty clear.
Okay. Let's vote.
Second.
Okay, that passes 6-0 with Councilmember Santos absent.
Your direction?
No, we appreciate that direction. I think Teresa's just going to explain what's coming to you for next week.
So mayors and members of council, so I believe that you have already gotten the packet or will get the packet very shortly for next week. It will not include the ordinances to adopt the budget and make the appropriations by fund. That'll have to come to you in a supplemental.
Got it?
Pardon me? They will come to you later this week in a supplemental. They will not be part of the packet that you will receive this evening.
Okay, now it's time for mayor and council comments. Councilmember Finley.
I think I better have a business of the week. But I was downloading my packet for next week and lost my place. My business of the week will be King Automotive out there on 119. They're actually the site of the Chamber's Meet the Candidates and Regional After Hours at King Chevrolet Buick and GMC on October 16th. The Longmont Chambers partnered with Carbon Valley, Berthoud Lions, the Latino Chamber, Meade, and Erie Chambers to host a regional after hours, and give them a call and go out there and check out our candidates and King Automotive.
Councilmember Levison.
Yes, there are a couple events coming up this week, and I think we have something at Dry Creek Park for the kickoff of Dry Creek Park, and everyone, is that 10 o'clock in the morning? Yes, 10 o'clock in the morning. And I can't remember what else I was going to say, but and then there was another I-25 CDOT meeting out in, is it Weld County Service Center, and City Manager Dominguez, do you have that? Is it Thursday this week? I keep getting more and more of these. Wednesday? Okay, so it's tomorrow, and it starts at what, 5:30, right? 5 o'clock. Okay.
4 o'clock.
4 o'clock for food. And that's to talk about the North I-25 corridor.
I don't know if this is the right forum to maybe bring this up, but I think it's probably time to, in the very near future, to reconsider our recycling, our curbside composting as an option. And I'm not sure exactly, how to bring that forward. If it's a study session and looking at things, and it doesn't have to be done in the next month or so. But I think it's something we need to put on our radar because we're getting a lot of people that are concerned about this, and I just think we need to get the data and decide how we're going to proceed, or if we're going to proceed. And so,
Mayor, we can bring that back for a study session. What I would ask is that as we also have some major water issues that we're bringing forward, and stormwater issues that we're bringing forward. So I'd like to get through that, and so we can
Absolutely.
get clarity there, and then we move into having that discussion.
Okay.
And basically on the timing, we're in October, it may be at the first of the year, but that lets us clear off some
Okay.
pretty big issues that we have on our plate, and it's the same folks working on all of it.
Right,
so
yeah,
that's
we might as
a
well get
big
the
part of
highest
it.
priority things done first, I understand that, so, great. I am.
Okay.
It's not for me. Okay, city manager, any comments?
Sandy's going to do an update on the meeting schedules because, as you may remember, we changed some of those dates, and we want to make sure that everyone's aware of that.
Thanks, Mayor Coombs, members of council, Sandy Cedar, Assistant City Manager. I just wanted to remind everyone that there's some Monday meetings in November. So, this is the following for the schedule for November council meetings. So the first Tuesday, which I think is Election Day, is a study session. Then the next Tuesday is Veterans Day, so your meeting is set for Monday, November 10th, instead of Tuesday on Veterans Day. The next week, many people are going to NLC, so as a study session, that is actually going to be Monday, November 17th, instead of Tuesday, the 18th. And then finally, your final regular session of November is Tuesday, November 25th. I just want to mention it because that is the week of Thanksgiving.
Is it on that calendar that you gave us?
It is on the calendar. It's already set that way, and it was something that y'all decided in January. I just want to remind you because there are a couple Mondays in that.
Okay. So we do have a city council meeting on November 25th, Tuesday, okay, great. All right.
No comments, Mayor, Council.
Okay, city attorney, any comments?
No comments, Mayor.
Okay, this meeting's adjourned.